day zero in your new life.
Day one, idiot.
I think you look terrific.
Thank you. Are you expecting me to make you breakfast?
You offering?
No.
You pink imposter, whoever you are, bog off and bring back my mom.
Knock 'em dead.
Thank you.
Obviously not actually dead. At least get through your first day without killing somebody.
Good luck, Mom.
Thank you. I shall clasp that to my heart, along with the very generous support from the men of the family. I don't think I'll get a chance to kill anybody today anyway. What are you doing?
Well, I'm gonna... Nothing much. What are you doing here anyway?
You crashing here while I'm working at the bar?
Morning! Oh, well, if that's the way you're going to be, fine. Well, I'll talk until you scream me to shut up, and as I haven't seen you a couple of days, there is loads to catch up on.
Shut up, please.
So, Tuesday, breakfast.
You're not going to stop talking rubbish till I throw myself open. Talk about my feelings, anything to stop the endless flow of garbage. Right?
Oh, you're good.
I don't want to talk about my feelings.
Okay. Any spasms?
Ow!
Why won't you admit there's some feeling there? Chris, why?
What? What if it doesn't last? What if it goes away again?
Don't be silly, be positive. Look, there is no downside. Your body's healing, all right? Oh, if that doesn't put a smile on your face, I don't know what else will. Come on. Now your turn, or I'll go and get a pen and draw one on. Ah, there you go.
It's got to be better than being a receptionist.
Of course it will be.
Hey, seeing as you're off, will you make my tea tonight?
Yes, I will. I'll order a takeaway. I'll chase these two off and then try and get some peace and quiet.
Okay, bye-bye.
Bye. Good luck.
One thing that I've been wondering, Amy, is how can your boyfriend read when he's blind? I reckon it's Gaz.
He's in Afghanistan.
You know, you're way out of your depth here, son. It takes years of finely honed detective experience to get to the bottom of something like this. See, lads your age are just far too immature for our Imogen. She's after the more mature bloke.
She was all over Heston at the party.
I was not.
Amy Ann Heston sitting in a tree. T-E-X.
You are an idiot. And you don't even live here.
She has a point. If this is going to become regular, we need to talk about rent.
Gotta go, Dad.
Bye.
You're back from your appointment with Harry?
Henry, yeah.
How'd it go?
Fine, thanks.
Hey, are you ready?
How do you want to work this? Did you like watch?
No, you're here to work. Who's first?
Mr. Morris, the chocker at the mill, so they asked him if he'd come here.
Okay, let's go and take a look.
Lyle.
Well, let's talk to him first, Karen. Mr. Morris.
Is it your piles again, love? Oh, well, you come with us.
Karen, it's your first day, remember? Baby steps.
We've got a visitor for you, Chris. Is it a good time?
Good morning, Chris.
Sir?
I've been asked to arrange a phone call. Sergeant Lucas back in Bastion. He'd like to speak to you.
Why, sir?
Well, the lads just want to hear you're okay. Let you know you're in their thoughts.
I can't. No.
It's a common reaction. Survivor's guilt.
Just think about it, okay? It'd mean a lot to them. And it'll help you. I'll check back later, Major.
Thank you, sir.
Why won't you talk to them? Why?
That's my business.
Chris, the lads are really worried about you, and it would really pick them up to hear that you've got some feeling back in your leg.
Shut up.
Hi, I'm Carl Ledbetter. I'd like to see a doctor, please.
It's quite a queue this morning. I might be able to get you in to see a nurse quicker.
We'll get you in to see Dr. Carmichael if he doesn't clear up, okay?
Karen.
Can you and Cherry see Mr. Ledbetter now?
Of course.
Yes, I can take him.
I've been up all night. Head buzzing, dizzy. I don't know what it is.
Have you ever had any heart problems?
No. I've been doing this clinical trial. Testing some drug.
What sort of drug?
I don't know the name of it. Something to do with blood pressure. But they asked me to keep this dosage chart.
Okay, well, there's a help number here. I'll give it a call, see if we can get some more information. Sorry to do this to you. Karen will just take your BP.
Shall we roll this later? Slip this over here. Have we met?
Don't think so.
No? Are you a friend of my Jack's?
I don't know any Jack.
How's general health been?
Fine.
How many units of alcohol a week?
Oh, hardly any. I'm saving.
Recreational drugs?
No. No, a monk could find my life boring.
150 over 110.
Is that good or bad?
It's not great.
What?
Nothing?
Karen, can I have a quick word?
Yes. Sorry.
I looked at his file and there's a note on the system from you.
He registered here about 6 months ago. There's no details of a previous GP. According to your notes, his mum deals with all that and was going to provide the details. You're supposed to chase it up.
But it's no big deal. I'll get his information and chase it up.
No, I'll do it. It's a small administrative irregularity, but if you could give us either GP's name
I can't.
or your mum and dad's number.
I can't do that either.
You don't know your mum's number?
She changed it.
Is it not in your mobile?
I forgot my phone.
Hey, I've just been speaking to the researcher coordinating the drugs trial. And
He's hiding something, I know he is.
how do you know?
I'm a mother and I know these things.
Well, I think we need more evidence than that. As I was saying, your blood pressure is higher than normal of someone of your age and health. Speaking to the researcher, she seems concerned. Apparently it's atypical of this drug. Have you any idea why this might be happening? Well, they want you in for a review.
A review?
I thought you didn't have your mobile phone.
Karen, I was just... Carl!
I've been looking forward to this all day.
Very glad to hear that, my dear.
That boy has got a guilty conscience.
I know I'm not a mother, Karen, but I did spot that.
Are you phoning the police?
And say what? We've had this boy in with a guilty conscience throw away the key.
Yeah.
Hi, Carl. It's Nurse Malone here calling you from the campus surgery. We need you to come back in.
Hey, you can't make me.
But it isn't about making you. It's about your health. You're not well. Now, will you please come back in?
Look, if it gets any worse, I'll come back, but...
Let me speak to him. I've got a bit more experience. Get yourself back here, now.
No.
You, young man, are in a lot of trouble.
I'll be fine. Just leave me alone.
Okay, here's the deal. You get yourself back here in 10 minutes, or we can tell the drugs company you're not cooperating with your GP and you don't get your money. Understand?
All right, I'm coming back.
Good.
Well, let's see if he comes back in first.
He will.
Now, if you are lucky enough to go to Firenze, you must go to the Uffizi. There's some beautiful, beautiful painting of the masters. There's Rembrandt, Da Vinci, Caravaggio. I mean, they demand to be seen. Although, I mean, you shouldn't ignore the lesser lights. There's no shame being second fiddle to Michelangelo. Now, I think you'll like this one, Artemisia Gentileschi. She's one of the few female artists of her time. She was a mistress of chiaroscuro. It's beautiful, yet quite gruesome. Sorry, I'm rabbiting on a bit. Heston's crash course in art history.
No, carry on. Maybe one day Mum will take me to the Uffizi.
Well, if she wanted to go, I could certainly find her the time.
Joke. Mom, art gallery does not compute.
Here we are, Judith slaying Holofernes.
Sessions are going really well. Yep. Henry's very good at drawing stuff out.
Well, that's great. Has he said anything to you about getting out more, meeting new people?
No, that's not really what the sessions are about.
That's a pity, because they should be. Well, I mean, look at the tap dancing. You're really good at that. And Charlie's friend, didn't she want you to join her dance school?
Wasn't for me.
Well, you were really up for it.
I didn't feel the need.
And what about that nice young guy that you met? What was his name? Ed. What happened to him?
Joined a commune in Devon, of course. It's all right. It's okay. I'm usually happy with myself and a small group of friends. Don't really enjoy drinking and partying. I never have done.
Oh, it's pathetic, isn't it?
I'm young. I suppose I do sometimes feel that my life is passing me by.
So, are you going to cooperate?
This blood pressure thing has nothing to do with the trial. I've not been eating properly yet.
We'll decide that. What we need to do is look back at your history before you registered here.
I've never been sick.
Stop mucking about.
I'm not.
Then either give us your GP's address or your mum's contact number.
She's at work. I don't have the number.
Stop lying!
Carl, could you wait outside for a second, please? Karen, you cannot talk to a patient like that.
He's lying. He knows it. We know it. We've even caught him at it.
How would you like it if an HCA called you a liar?
I'd be furious, but then I'd be telling the truth. Something's not right about this lad. And we might find out something important.
Or you'll scare him away again.
You don't know young men like I...
I know young men. Now, do we do this my way?
Yeah, cool.
Okay, so back off. Carl, could you come back in, please? Take these.
What are they?
I thought you lot were supposed to be good at taking orders. Still sulking about that phone call?
No.
Liar. So why won't you just talk to your mates?
How's Jess?
Is that why you won't talk to them? Because you're on the mend and she's...
Because she might be stuck like that for the rest of her life. If she doesn't die...
There's every reason to stay positive. That's why you need to take that call.
Like you know anything about it.
I know what I see. And you're scared. I think your mates just tell you the same thing. You've got nothing to feel guilty about. It wasn't your fault. Say it. Say it wasn't my fault. I've got nothing to feel guilty about. I'm not going to go until you say it.
It wasn't my fault. I've got nothing to feel guilty about. Happy?
Static. Better?
Yeah.
You know what? People here indulge you too much. Not me.
Ruth, I completely understand why, for you, the fear of losing control must be crippling. But I really do think you've got to get over that. And it's not just about your social life. I mean, you're stuck in your comfort zone here. Is a receptionist really all you want to be?
No.
So, what do you want to do with the rest of your life? I mean, I don't really want to be sitting here next year with you having this same conversation, Ruth. You're way too bright for that. And look at Karen. She can stretch herself.
Karen's much more confident than me.
Okay, let's get this blood tested.
Good nurse, bad nurse, is it?
Karen's not a nurse. Can you pass me the dosage chart, please? Okay, I'm gonna speak to Dr. Granger. Karen, could you get Carl a cup of tea? Okay, and I'll be back in a sec.
Jerry, I'm so sorry. I didn't mean to challenge your authority.
You didn't. It's fine.
Do you want the number off it? I thought it was something pharmaceuticals.
Yeah, call some pharmaceuticals.
And it says here Wales Research.
It's a different dosage chart. You're doing 2 drugs trials.
What? No.
I never gave you back the first dosage chart, and you gave me this, the second one. You've got 5 seconds to explain yourself, or I'm calling both companies.
No, please don't.
1, 2, 3, 4. There's no 4.5.
All right, I'm doing 2 drug trials.
Why?
How?
I need the money.
But they'd contact the GP, we'd notice.
I'm with 2 surgeries. My mum and dad are divorced. I'm registered at home with my mum's name and here with my dad's. I registered here when the flu bug hit the uni, and I knew the place would be slam busy and you wouldn't look too closely. I recognised you when I came in.
See, told you he was up to something.
I best get back to work then.
Listen, Ruth, promise you'll think about what I said.
I've really got to look up some of these paintings on the computer.
No. Look, books aren't ideal, but the internet is horrible. I mean, you've no idea how tactile these paintings are. If you see them in the flesh, so to speak, you want to touch them, you want to feel the brushstrokes.
Isn't that a bit pervy?
Have you never been to an art gallery? Not even with school?
Not this old stuff.
Look, if I could take you to one of these wonderful galleries, I think you'd understand. You know, I envy the fact that you have this opportunity to see these paintings for the first time.
But I don't have the opportunity, not until I can afford to go to Italy myself.
Well, you know, go to the Barber Institute. I mean, that collection's a good start.
Only I had someone to show me around, someone who knows what they're talking about.
All right, don't ladle it on. Of course I'll take you.
You've been risking your health.
I had to.
It's fraud. We should call the police.
No, please don't. I'm trying to do the right thing.
The right thing? This should be interesting.
Karen, give him a chance.
My girlfriend's pregnant. I'm going into my final year. I want to look after her and the baby, but I need to finish my degree so I can get a decent job.
Why don't you get a part-time job?
There aren't any. Look, this lets me earn a little money while I keep studying.
You expect us to believe that rubbish?
If you report me, I'll get a criminal record. I'll never get a decent job, even when I finish my degree. Please.
I want to help you, I really do, but we cannot just ignore this. Can you give us 5 minutes, please? What are we gonna do?
Michelle, what's this about? Just tell me.
You'll find out. Chris will take that call now.
Sergeant Lucas and the lads are on the other end. They've been looking forward to this very much.
Would you like some privacy?
Chris, they're waiting.
Sarge? I'm not too bad, Sarge. That promising football career's down the toilet, but there you go. I'm getting some feeling back in my legs. Hopefully I'll make a full recovery, but it'll take time, Sarge. What about you lot? You seen any good firefights lately? Time to go on a diet. That fat gut of his is an easy target. Sarge. No, Sarge, listen. I'm sorry. I'm sorry I'm not there. I know, but... No. I ain't seen Jess.
Sergeant Lucas? Barker again. So you know, Sergeant Faraday is still unconscious in critical care.
Just get me out of here.
He's tired, so I think we'll wind this up now, Sergeant.
We've got to call the police. It's our duty.
Karen, I know what my duty is. He's right. If we tell the police, they'll get a record. They'll struggle. What sort of a start is that for a young family?
We should have thought about that before.
He was stupid risking his health.
He's a victim now.
Well, if you'd done your job properly in the first place, this would have been nipped in the bud. Maybe we can get him off the clinical trials.
Well, he's not exactly volunteering the information, is he? We can't turn a blind eye.
Karen, we do it all the time. If he told us he was taking illegal drugs, we wouldn't go running to the police. Patients have to believe that they can be honest with us and we're not going to grass them up.
This is different. He used us to defraud people. He's a liar. He's lying now. That stuff about the pregnant girlfriend. Please.
Maybe she's got Fabio Capello under there.
Hi, I'm Megan. I'm Carl's fiancée. He told me what happened. Please don't call the police. We don't have any money. We don't get money from our parents. I put my degree on hold. If Carl doesn't finish his...
Can I have a look, please?
You have got to be kidding.
It's beautiful. Okay, this is what we're going to do. You're going to end both drugs trials. You're going to be reviewed by both trial doctors. I'll arrange it. I'm going to find out exactly what these drugs are doing to you. If you cooperate, then we don't have to get the police involved. Agreed?
Yes, anything.
You're making me an accomplice to a serious crime.
Karen, enough. It is my job to treat the patients. It's yours to make sure that they're comfortable.
You okay? It's a lovely day outside. Why don't we walk in the gardens, play dodge the helicopters?
Just want to be left alone.
I know you think we're criminals, but we didn't plan this. If this hadn't happened, we'd be home with our folks for the summer.
I felt so crap since I started taking those drugs. I'm supposed to be there for Megan, but I'm scared.
I'm kind of glad the nurse found out about the trials.
Okay, that's you registered here properly now. I've spoken to both researchers and they'll see you today. What you tell them is up to you and your conscience. Now, we need to see you regularly. Karen, Dr. Granger and I are going to be watching you like hawks.
Is he going to be okay?
Hopefully. We'll check out the BP and then you can go.
140 over 90.
Good. Okay, go before I change my mind. You can't challenge nurses like that in front of patients. You're pushing your luck. If that had been a doctor, you would have been out of here before.
I think that you were probably right about not calling the police.
I know I was right. I spoke to Daniel and he agreed with me. There was some stuff that was okay. Your actual ACA work was fine. You did well taking the blood pressure, your patient care was good, and your tea making was fantastic. And your instincts about Carl were nearly spot on.
She said my patient care was excellent, and if I hadn't spotted what he was up to, he'd have got away with it. I've obviously honed my observational skills and keeping beady eyes on you, Jack.
So how did he fall the practice in the first place?
Yeah, shut up, Jack.
I'm very proud of you. We all are.
Well done, Mom.
Aren't we, Jack?
More than words can say. So I wait. Anyway, I've got to go work, so I'll see you later.
What are you up to?
Oh, stuff.
So, you enjoyed it?
Yeah, I mean, it's more challenging than I thought, but that's what keeps it exciting, isn't it?
Hey?
I've had loads to do, but I've been dying to show you this.
Show me what? This better not be another stitch up.
It's Jess. She's out of the coma. Chris, are you okay?
No, I'm fine. Never been happier. Great news.
It's Jess. She's asking to see you.
He was wounded trying to get help with someone who was shot by a sniper.
Brave.
Except that every time he tells the story, it's different.
Do you have an interest in old masters?
Normally got a ceiling of 25, but you never know.
It chose me. Those images chose me. I chose you.
Tonight's Beechgrove checks on the progress of Girvan's community garden. That's